call it amyotrophic lateral sclerosis. It is a progressive. I might have a empty space here. I'll tell you here. So amyotrophic lateral sclerosis is
Is this a
ALS.
form of motor neuron disease?
Yeah, it is specifically upper motor neuron or lower motor neuron disease, but usually the lateral sclerosis affects only the upper motor neuron.
Okay.
Okay, so ALS is basically amyotrophic. It's progressive. It's neurodegenerative. It is progressive. It is degenerative. It can affect upper motor neuron lesions plus lower motor neuron lesions. It is the most common form of motor neuron disease, MND. So it is called amyotrophic lateral sclerosis, amyotrophic. So why it is known as this? Because amyotrophic means muscles are wasted.
Yes. What's wrong?
Muscle wasting is there. And lateral means involvement of lateral corticospinal tracts. So imagine the laser passes through the spinal cord. And sclerosis means after burn, scar formation is there. So there are scars are formed. All right, amyotrophic lateral sclerosis. So patient can have element signs like muscle wasting is there, fasciculations are there. I told you, no, lower motor neuron signs, weakness, hyporeflexia is there,
Hyporeflexia.
and upper motor neuron signs can also be there. For example, spasticity, hyperreflexia, Babinski's sign, that is extensor plantar, and they can have bulbar involvement also, brain dysphagia, dysphonia, tongue wasting. I think I might have a patient. Oh, I have a patient's video. Let me show you the video. I think I have. Just a moment. The patient came to me like 3 years back. Let me just see if I have his video still now. The patient has died anyways. So the video that you'll be seeing is a man he's living no more. But then I still have his video with. See.
Yes. Failure of abduction.
Yeah, he was uncontrolled diabetic. We could not find anything in him. No, nothing. See, he just cannot take his eye beyond the midline.
Yes.
I'm looking for another video. Okay, let me show you. Let me show you some Korea also. Yeah, this is Korea. See what is she doing? See how beautiful.
Yes.
She was having coriform movements everywhere. I'm looking for. This was like 3rd March 2022. This is like 4 years from now.
But how do you treat then this type of patient?
Riluzole is very effective.
Riluzole.
Okay, let me show you another patient. You make a diagnosis. What does she have? Have you seen a rabies patient?
Rabies patient, yes. We have seen, but in the ID hospital of Kolkata, but forgotten, sir.
Yeah, I have an rabies patient also. They are kept in my patient. Okay, just see. Don't miss on any diagnosis. The patient has, okay, I'll give you a hint. The patient has 2 diagnoses, not 1, 2. What does this patient have? She has ptosis of left eye, if you see carefully.
Ptosis and the angular angle of mouth is also
Angle of mouth
good.
is fine. She has ptosis and she has lateral rectus nerve palsy. So she has third nerve and sixth nerve palsy in one patient.
But she can just abduct.
Yeah. So she was uncontrolled diabetic. HbA1c was 14.9.
Okay.
She's so young.
Hmm.
You can make out the ptosis from a distance. Left eye. All right. Here comes the big bonanza for the day.
ਕੀ ਨਾਮ ਤੇਰਾ ਹੱਸੀ ਜਾ ਜੀ ਬਾਹਰ ਕੱਢ
See the fasciculations. Go close.
Hmm.
ਕੀ ਨਾਮ ਤੇਰਾ ਹੱਸੀ ਜਾ ਜੀ
By the
ਬਾਹਰ ਕੱਢ
time he came to me, he couldn't speak. He could only produce nasal sounds.
Okay.
So this is amyotrophic lateral
ਕੀ
sclerosis.
ਨਾਮ ਤੇਰਾ
He could not swallow properly, so he had stopped eating altogether. So he was on his way to death only. This patient has passed away now.
Hmm.
Yeah, he was young. This is from 26 February 2024.
Hmm. So rapid.
Unfortunate, but this is how it is. So bulbar involvement is very common. Tongue wasting and fasciculations are seen. So it is, they usually, these patients, they have mixed UMN LMN signs because wasting fasciculation of hands is LMN. Knee jerks are hyperreflexes and Babinski is positive, that is for upper motor neuron.
Yes.
Sensory function is purely normal.
Yes.
Purely normal. No sensory loss, no sphincter loss, no eye movement problem, no ophthalmoplegia.
Yes.
Okay. So the treatment is riluzole, edaravone, and non-invasive ventilation, blah, 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 you know, all of that. But it is a progressive disease, always remember. So ALS has UMN plus LMN. Let me draw it for you. So ALS has UMN plus LMN both. PLS, that is primary lateral sclerosis, has UMN only.
Only.
And progressive muscular atrophy.
This is element.
It has LMN only. Rest, this patient of mine, he had progressive bulbar palsy.
Okay.
He mainly had progressive bulbar palsy. He died of aspiration, most likely. He slept and never woke up. So bulbar motor only. So this is amyotrophic lateral sclerosis. So upper motor neuron plus lower motor neuron. Primary lateral sclerosis is UMN only, and this progressive muscular atrophy is LMN only, and progressive bulbar palsy is bulbar motor. So this is all for the day.
Thank you for excellent teaching.
Yeah,
And
thank you
you
so
have
much.
explained everything in a very lucid manner.
Thank you. But you